This is breaking news from KETV News Watch 7 and KETV.com. Good afternoon again. I'm Alexandra Stone. We are back to bring you the weekly briefing by Omaha Mayor Jean Stothert and Douglas County officials on the coronavirus impact. Douglas County today reported 177 new cases and one more death. The mayor just started, so let's join her now.
Who is the medical director of the Omaha Police Department. We've been doing some testing of not only the fire department, but the police department, and he's here to kind of go through that with you and tell you what all of that means and what we're going to do with that information in the future too. And then Steve Curtis, my finance director, is also here again today to give you an update on some of the financial numbers that we have been getting and to talk a little bit more about what we know more actually with our budget now about the shortfalls and about the expenses we have, so that you are fully aware of what is going on with our budget. So we're going to start out first with Dr. Poore today, and she has a lot of information, as we usually do. We'll wait for the questions after we're all done presenting, and then you could call whoever you want back up to the podium. So Dr. Poore?
Thank you, Mayor, and thank you all for being here this afternoon. I thought I want to start out with a saying today. And the saying goes, the virus can infect anyone, regardless of race, ethnicity, social status, or beliefs. So we need to keep that in mind. It's really important. But I also want to report today that we are now at 2,088 cases in Douglas County, and that is as of midnight last night. When I talked to you about a week ago, last Thursday, when we had the news conference, we were at 1,205. So we have increased quite a bit. What we also have seen is that we have had a lot of testing that has occurred over this week, and I guess that is good news about it. So far, we have done 13,859 tests in Douglas County. Last week when I talked to you, it was around 9,000. So what that tells us is that we have done approximately 4,800 tests last week. Our positivity rate is at this day 15.8%. It's going down a little bit. When we are looking at it at the week, our week ends on Saturday, so we still have data for 2 more days. I've talked to you a lot about our age range, and our age range is still more than 50% in the 25 to 49 years old. When we talk about race and ethnicity, I think I shared with you last time that our minority population as a whole makes up 69% of our cases, and this week it actually is 74% of our cases. We have 12% in our African American population, Hispanics make up 46%, Asians 16%, and then we have Native American and Native Hawaiian make up together 1%. Also, we need to report 24 deaths this week. Last week we had 17, and so it's a sad week from that perspective. But I want to follow that with some good news. We have 390 individuals who have recovered from COVID-19. 12% in our Asian population, 15% is in our African American population, 37% fortunately in our Hispanic population. Let me talk a little bit about different exposure and different sectors that are being affected in our community. When we look at it, we are looking at it by clusters, meaning more than one case in a facility. I want to start out, we have 1,063 cases in our community that are related to employees, staff working in the meatpacking industry. That's not all in Douglas County, that's also the surrounding area. We have long-term care. We have 10 long-term care facilities who are affected in our community, and we have a case count of 153 individuals who are infected. So meatpacking and long-term care is actually making up 58% of our entire count. We have 2 shelters in our community that you have heard that have had positive cases, and they are doing an excellent job in really trying to separate individuals who are sick from other guests in their facility. We have 9 other outbreaks in our community too. These are mainly manufacturing plants, or as I have talked to you before, they could be a church function and so on. We had some good success yesterday in bringing in the National Guard to South Omaha to really see that there were so many individuals who wanted to get tested and couldn't get tested through One World. So we set up a site with the National Guard and the assistance from the governor's office, and we tested 206 individuals yesterday. Depending on the weather, they are planning to do more testing this Saturday and Sunday. But drive-through testing in bad weather is really not a good idea. So we are still at this minute, actually, when I walked in, they're still looking for potential site to test, especially on Saturday. Sunday, I think the weather may be better. Let me talk to you a little bit about hospital capacity, because we know how important that is. We do not want to overwhelm our hospital systems. As of today, we have 113 patients who are inpatient in hospital settings. That was 88 last week. So you see we have increased in that. We have 63% of our med-surg beds who are occupied at this time. And we are pretty well for ventilators, and that's always the good news in our community. Our capacity is large for ventilators. We have 125 ventilators who are used at this time. That's out of a total of 374. 40 of those 124 ventilators are used by COVID patients. I want to talk to you a little bit about testing. I want to make very sure that everybody understands where they can get testing. They can get tested through their healthcare provider. There are many systems, hospital systems, who are doing testing. Individuals there would need to do an assessment online to get into that testing, but healthcare providers have tests, and they should be able to afford to provide you testing. Then we have Test Nebraska. We have always talked about that. That site, Test Nebraska, is going to stay in Omaha permanently at this time. As far as I know, I've just confirmed this, for the next week they are going to stay at the CHI Center, but they are looking for other opportunities to move around in our community. So will any input you may have. And then we have this community testing that is now being set up by the National Guard. This is mainly for South Omaha because we see the need for testing in that community. I want to close just with something, a real nice discussion I had with the Omaha Sioux. And I am so proud of the Sioux and about their leadership, because in their discussion with me, I have just really concerns for the Sioux. They have a very good 3-tier plan in place, where in the first phase they would only be outside and so on. But I have been able to talk with their director to say it is too early to open up. And so they have planned to open on Monday, just as phase 1, which will be walking through the Sioux and have really a good plan in place. But they have delayed that to June 1. And I want to call this out because that is an example of somebody who is responsible in our community, is looking at data and is making decisions based on what's best for our community. And so I would hope this is an example for some of the other businesses and organizations who are trying to see when can we open or how can we get around it. How can we get around it is actually my last talk. There are so many calls that we are getting in our information hotline, and I know the mayor's hotline is getting them too. that has to do about masking. I went to a restaurant and the server didn't wear a mask. I went here and there and they didn't wear a mask and they didn't follow. Let me make very clear, the direct health measures that were put out by the governor, they are enforceable. In regards to masks, they are very clear. Masks need to be worn in hair salons, nail salons, massage parlors, by the staff and by the guests who go into those businesses. That's enforceable. However, mask wearing in restaurants is not enforceable. It's a guideline. It's a guideline that the Nebraska Restaurant Association put out. It's best practice. But don't call the hotline or the information line to rattle on those type of businesses. And we won't have OPD go out and enforce those. OPD has other issues at their hand. So, but what you can all do in this community, if you are going to a restaurant and you have a server who comes up to you and serves you and isn't wearing a mask, you should tell that server, I would feel very much better if you would wear a mask. It is up to us to tell each other what our expectation is. And let us remind us, you wearing a mask, you are protecting me. Me wearing a mask, I am protecting you. So let's not forget this message. And with that, Mayor, I think I'll leave it up to you. Thank you.